Okay, great. Now I'm excited to introduce the speakers for our featured program. They have co-authored a groundbreaking survey on global herd immunity. And I know, given all the discussion lately about herd immunity, we are all curious, what is the path to herd immunity and how do we get there? Our first speaker, Michelle Nunn, is CEO of CARE USA. She is also fellow Rotarian. Through CARE, she is spearheading an ambitious strategy to help 200 million of the world's most vulnerable population as they seek to overcome poverty and social injustice. Her goal is to do that by the year 2030, very ambitious agenda. She also has a wonderful track record leading the Points of Light organization, which is the largest global volunteer service organization. So she's well positioned to take on this challenge. And then our other speaker, Horacio Rozanski, is CEO of Booz Allen Hamilton, which is one of the premier global consulting firms. He's a widely respected leader in the global consulting industry and has transformed his own organization with an inspiring mission to empower people to change the world. Horacio is also recently the recipient of the Horatio Alger Award, which is given to an elite circle of distinguished Americans. So we have two fantastic speakers. We will have both of them join us on stage here now as they talk about this study, and then our program co-chair, Bill Henagan, will join in a few minutes to lead some of the questions and answers. So Michelle, Horacio, welcome. Thank you so much for this impactful work you're doing, and we can't wait to hear what your findings are.
Thanks so much.
Thank you.
Really grateful to be with you all and grateful to Bill for enabling us to have this opportunity. And I'm really pleased to be here and sharing the stage with Horacio. And so let me just give a little bit of context. First of all, I think everybody knows that CARE is in Atlanta. I hope so. And I hope you know that CARE is celebrating our 75th anniversary this year, that we actually were started by a group of brave and audacious Americans who said we're not going to stand on the sidelines and watch people face starvation. And post-World War II Europe, we've grown from the original invention, creation, and deployment of those care packages that help people survive during that period, deployed over 100 million care packages, but now work in 100 plus countries. Last year reached 90 million people. So you can imagine that as COVID hit in March of 2020, CARE understood that this was a generational challenge, a historic moment for us, and that we would want to and need to respond, that many of those who would be impacted by COVID would be the most vulnerable and the ones that CARE serves around the world. And so we launched a response that has over the last 18 months, reached over 35 million people. It's done some of the basics, like ensuring that people had access to clean water. It's also ensured that people actually had access to food. One of the ripple impacts of COVID, especially in low-income communities, has been a real significant rise in hunger. But at the early part of this year, and actually at the end of last year, at the end of 2020, CARE started gearing up for what we called our fast and fair vaccine efforts. And what that meant was it was a campaign to ensure that we not only focused on each one of our countries getting vaccinated. We knew that work, important critical work was happening, was gearing up here in the U.S., but also recognizing that we would not be safe, that none of us would be safe until all of us were safe, and that perhaps that focus on global vaccination was not getting the attention that it needed. Now, there's a lot of talk about vaccination, the supply side of vaccination, which has been incredibly important. And even the most ambitious plans still have only a fraction of the population in low-income countries having the supply that they need. But there has also been very, very little actual sort of focus on the delivery of the vaccine. So if you can imagine all of the work that's happening here in the US to get these vaccines out through multiple different stadiums, going to Walmart, CVS, offering beer for your vaccination at a ball games, all of those things. And then think about what is it going to mean when we have very limited health infrastructure in a place like South Sudan or even in middle income countries like Argentina or Peru. How are we going to ensure that we focus on that? So Horacio, who is, I'm very proud, one of our CARE board members, in addition to leading this amazing company, I want him to tell you a little bit about the work that he does in his day job as well and how he became interested in this. But we were talking and we said, we should do a study taking CARE's knowledge, taking Booz Allen's knowledge and expertise, and look at what is it actually going to cost us to deliver these vaccines, and then what is it going to cost us if we do not. And obviously we know that that it will cost us enormous numbers in terms of lives if we don't deliver these vaccines in an equitable way around the world. But it also will cost us from an economic perspective, and not just the global economy, but the U.S. economy specifically. Right. So that is the sort of auspices of the study that we did together. And so I'm going to start, and Horacio and I are going to just sort of turn this a bit into a conversation and have some fun with that engagement and that exchange. But I want to start with Horacio asking you to give us a little bit of information about Booz Allen, about your work there. I will just feature and brag on you a little bit, but I know that you made the journey within the organization from intern to CEO, which is quite an extraordinary journey, and that you were just recently, in addition to the Horacio Alger Award, were just awarded in 2021 the Glassdoor Top CEO Award. So clearly doing a lot of things right within the industry, but also I think have a real keen understanding of the implications of COVID, but also broader issues of social justice and how that impacts your business. So over to you, Horacio, to tell us a little bit about that, and then we can jump into the report. Thanks, Michelle.
First of all, good afternoon, everybody, and thank you for having us today. It's a real honor and a pleasure, and I have a good PR team, which is why these awards are there. But Michelle, your words mean a lot to me, and right back at you. What you have done over many years, but especially in the last 18 months in leading CARE through this just harrowing journey of COVID-19, and what you've done, not just for your organization, but for our country and across the world is truly spectacular. And your leadership has been instrumental in everything that's happened. So thank you. Thank you. I'll start by saying I am not an expert on these topics. I'm here really representing the expertise of my more than 28,000 Booz Allen colleagues who work on these issues day in and day out, who really know what this is all about. If you don't know a lot about us, the 30-second elevator pitch is we've been around since 1914. In 1940, our founder was asked by the U.S. Navy to help them get ready for World War II, and we've been serving both private sector clients and government clients really since then. These days, we're about $8 billion in revenues. As I said, over 28,000 employees, most of them in the U.S., but really scattered around the world. And what we do for a living is we bring leading edge technology, especially into these government missions. We help our clients figure out what does the cloud, cyber, AI, all those things mean to them. In Atlanta specifically, I'm proud to say we have an office on Peachtree Street downtown. We have over 400 people. We serve a variety of clients, but not surprising to you, the IRS and the CDC are our two largest clients in the area. And we do a range of work with all of our clients, but we have been very involved in the entire vaccine issue and vaccination issue all the way from the very beginning in terms of capturing the data around COVID-19, helping Operation Warp Speed, and helping in the deployment of vaccines. But really the impetus for this study had nothing to do with that. I was really born out of a conversation between Michelle and I was lamenting the state of COVID and vaccination in my native country in Argentina, where I still have a lot of family. And we got to talking about what's happening around the world. And Michelle made a point to me that really is, that if you remember one thing out of all of this, is this point: nobody's safe until everybody's safe. Nobody's safe until everybody's safe. That is the basic tenet under which we got involved. CARE has been leading the way. and we're working together. In case you wonder, because we do work for the government, there's no self-serving part of this report. We don't make any money in vaccine distribution or any of that. I have a personal interest because of my family. I have a personal interest because we have so many people around the world, and our employees have families also around the world, and they're all suffering. When we were having our discussion, it seemed to us that the moral case for the United States getting involved and leading the way was clear, but that there was a business case that wasn't getting talked about. And that's what we tried to capture in this report. What is the business case for helping the world get rid of COVID? And so we did some math together. The first thing we did is we validated a study that CARE had done that shows that for every dollar in the cost of money spent on a vaccine is going to cost $5 to get people vaccinated. So having the vaccine, $1, $5 to put that in somebody's arm. When you look at all the numbers, to get 80% of the world's adults vaccinated, it would cost about $190 billion. And that's a staggering sum. I would agree. If you spread that around the countries and that have the ability to pay for this and support the rest of the world, the U.S.'s share is somewhere north of 15 billion, 1.5. And again, those are really big numbers. So you have to say, as a business person, what would be the return on that investment? Well, I've come to think about it as almost an insurance policy, because these variants that actually are very dangerous and can ultimately defeat a vaccine are directly related to how many people get infected and how much transmission there is. Because if the virus doesn't move from person to person at rapid speed, it doesn't mutate. And it's the mutations that we need to be worried about going forward. If one of these mutations were able to defeat the existing vaccines, a conservative estimate of the cost to the United States would be around $500 billion. And this is, not even talking about the moral issues around people dying and everything else that, of course, are at the forefront and are already being discussed. And just doing math, for $15 billion, we can buy an insurance policy to $500 billion loss. And so, if nothing else, this is good business. More importantly, it's the right thing to do. And if you want to be completely selfish about it, as I said, nobody's safe until we all are.
Well, I think you articulated it really brilliantly. And I do think back upon that original conversation, and also think back then about what's transpired since that conversation. We've seen what's happened in India with an extraordinary humanitarian crisis with the rise of COVID cases. We see what's happening right now in Africa, where just last week they had a 40% increase of the death rates in Africa. So I'm afraid that what we're seeing is not only the humanitarian consequence, but we're also seeing then how those variants are coming back to the U.S. shores. How we are going to see that is likely the variants that continued to spiral out in places like South Africa, the UK, right, and India, and now are in our own backyards and making it less safe for us to continue around the business.
Yeah, Michelle, so I was going to ask you that question. So, we all read the paper and we all see some of this stuff, but what's it really like on the ground in the places where CARE has people and you're helping get vaccines into people's arms? What are you seeing?
Yeah, in so many places that we work, we are now seeing, I think, the kind of threshold that we saw in New York in the spring of 2020. But to keep in mind that the health systems, the ecosystems of support that were available in New York are simply not available in India, in Indonesia, as an example. So that happens on multiple fronts. In India, for instance, CARE has been surging response, and we've been doing that just to ensure that people have hospital beds, that we've built actually 15 hospitals 15 hospital facilities in India in the last 8 weeks, just to ensure, again, people had beds. We're also trying to surge our vaccination efforts. In a place like, India, again, which has been one of the suppliers we were looking to India as the supplier of the global vaccine supply, and they're going to have, at our best and hope and aspiration, a third of their population by the end of this year vaccinated. In Africa, which is 20% of the world's population, 1% of the African population right now has been vaccinated. So we are seeing, I think, just the absolute humanitarian crisis that's been precipitated. We're also seeing in the U.S., you all well know, we were able to, the U.S. government, to pour in trillions of dollars into our economy to create safety nets for people. That's not happening in places like Indonesia and India. People who depend upon their livelihoods to go out into the markets on a day-to-day basis. So we're seeing a real retreat in terms of the poverty rates and also in terms of hunger. So we're facing, I think 40% of the countries in which CARE is operating now have food insecurity as being one of the prevalent threats to the populations there. So it is a really dire situation. It is, I think, really also, I think we just as Comer pointed out to us, that it is sober in terms of the realities of, for instance, literacy rates in Atlanta. It is also solvable. We can address this. We can create the infrastructure, invest the resources that seem like a lot, but relative to the cost are very de minimis, and that we do know how to vaccinate and to vaccinate the world. We've seen us conquer, for instance, the Ebola epidemic in West Africa. We know how to do this, but it does take the political will, it does take the resourcing, and it does take the advocacy and awareness. And I do want to highlight that I think the business community is particularly well able to see the consequences of this, because so many businesses are working at a global level. So, maybe back to you, Horacio, is anything that surprised you that's come out of the study or that's come out of the most recent trend lines that we're seeing in terms of your own business and how you're seeing the business sector respond to this at large? I'm
not sure. Well, I think the one thing that was surprising was this 5-to-1 ratio. It's every business executive, and I know there are many on this broadcast today, knows that the last mile is always the hardest, it's always the most expensive, it's always the most challenging. Of course, this is going to be true here. But 5-to-1 is a big number, and we're not really talking about it. I think we are all understandably still worried about getting the vaccine to these countries. But that is just to understand that is only a small part of the battle. And in fact, the biggest challenge is going to be getting the vaccines from the depots into arms all over the world is really a daunting challenge, especially, as you pointed out, in places where there's no infrastructure. I think the business community, to your point, understands that really well. We don't have as many people around the world as many of my colleagues do. But we see it in our own populations, and we see the disruption to their lives, the fear for their families, the difficulty getting through the day, and how things exacerbate these challenges. We have a good-sized team in Lebanon, for example, and when there was a horrific explosion in the port, that made everything much worse because you were now dealing with compounding, multiplying effects, and a city and a country that had managed to keep things more or less on track. How do you do social distancing when nobody has windows, when nobody has food, when people need to be in the streets helping one another? So those are the kinds of things that I think weigh heavily on all of our minds, and these are the places where we all need to get involved. I'll tell you, this is not theoretical for me. I have a lot of family still left in Argentina. And Argentina made the decision to go with the Chinese vaccine. And now all the studies come back and say that the Chinese vaccine is relatively ineffective against the Delta variant. And so, it's lots of people are going to die because of that bad decision. And frankly, I think we can do more. I think we should do more. And like I said, altruism is a big part of it, but it comes back to it also helps us, it helps our businesses, it helps the U.S. economy. There's goodness all around. Michelle, I get a sense, and hopefully we've done a good job between you and I of sort of setting up the imperative, and maybe people are sitting in their homes or their offices listening and saying, okay, so what can I do? How is CARE taking these ideas forward, and what can people do to get involved?
Yeah, I think it's a great question. I would say, first of all, help relay the message of the importance of global vaccinations. I think what we're going to see, actually, and I'm worried that we're going to see it. We're already seeing it on the ground, but I think you're going to start seeing in news reports in the fall that some of the supply is reaching these countries, and they don't have the capacity to deploy against it. So, for instance, in the DRC, it took 7 weeks for them to get to the point where they realized that they could not get the 1.7 million vaccines out from the tarmac to the last mile delivery. And so they had to return 1.3 million doses. We are seeing that in South Sudan, where they had to destroy 60,000 doses. So again, I think part of this is the recognition, think about how hard it has been in the US to build up our infrastructure, then think about doing that on a tiny, tiny fraction with very limited health infrastructure. And so I think we want to get ahead of that to the degree that we can. We want to send the message to Congress, to our leadership, that we are behind and understand the importance, the farsightedness of actually taking action here before we get to that point. I think that as business leaders, so many of you all are business leaders, private sector leaders, you do have a unique vantage point. So you have you know what your employees are facing around the world. We're having a large number of partners like Booz Allen in Lebanon after the explosion, in India, who were saying our employees, we're recognizing what's happening for our employees. We have to do something here. So corporations, I think, have specific visibility. They also have, as you said, kind of capacity that is unique around last mile delivery. So offering up that assistance to big organizations. UPS is a great example of a humanitarian leader in the corporate community, partnering with organizations like CARE around how we can ensure that we get ahead of this. If folks go to the CARE Action Network or the CARE website, so more simply, you can get more information about how you can become an advocate. You can get more information about the report that we created together. We're looking for the kinds of leaders, Horacio, who, when you bring somebody like Horacio to a meeting with congressional leaders or with members of the National Security Council, it signifies something different when you partner together with humanitarian organizations and say, this is a priority for all of us. I think it creates a different kind of voice and affirmation. So I think those are some of the things and some of the ways that I hope that people will lift up their voices and specifically engage in this question. So Horacio, I guess just again to put a point of emphasis on how you're thinking about lifting up your voice, the kinds of work that your team has done. We've done op-eds. We've done briefings with, again, the members of the executive team and the Biden administration. I think as you're thinking about the next horizon of addressing this pandemic, what are some advice that you would have to your fellow business leaders about their engagement?
I think that if this is a topic somebody cares about, and I hope lots of people do, that the voices need to be heard. I think we live in a time and a moment where everything is political and politicized, but I really do think that this can live beyond the politics of it all and get to a place where we as business people can just talk about what's in the interest of our employees, what's in the interest of our companies, what's in the interest of our country, frankly, what's in the interest of our national security. If you look at what's happening in the Southern Hemisphere, this is destabilizing borders, creating migration, and creating opportunity for bad people to wreak a lot of havoc. So this is in my view, one of these few issues where pretty much all the things are aligned and everything everything can work together for the common good if we decide to take it on. And the more voices and the more companies and the more people that are willing to tell the story, the better off we're going to be.
Yeah. I think that there is also a balance between the kind of sober realities that we see on the headlines of the New York Times, what's happening in Indonesia as an example, now what's happening in Africa, but also a sense of helplessness around what is my role, what can I do here? And so I think just encouraging people that you have, first of all, you have the capacity to contribute. I think we do face the danger of kind of compassion fatigue as we see these multiple crises layering upon one another, but we can't give up on responding. So I think back on those that responded 75 years ago in the wake of World War II. I think about not only the care package, but the Marshall Plan, what that's meant to the stability, both economically, but also from a national security perspective, to the stabilization of Europe over the last 75 years. And that's the kind of far-sighted leadership we need. But it starts with individuals who say that this is important, who make contributions to organizations, the many kinds of organizations that are doing the work that CARE is doing in the world, but also who are willing to lift up their voices, because I'm afraid that our political leaders are not necessarily hearing what is your global COVID strategy. And I think that we need people who lift up the importance of that and remind them that at this juncture, we need far-sighted leadership, not just leadership about what's going to work today or tomorrow, but an understanding that, as Horacio said, if we don't actually address this, that it's not just this month or it's years to come that will imperil our not only millions of lives, millions of additional lives, but also our global and our national economy. So I hope that folks have some sense of resonance with that and will find their own voice in this. And Horacio, I know you might have some additional reflections.
No, maybe Michelle will invite Bill to join us and maybe see if there are questions from you. And I can talk about this for years to each other, but maybe there's other folks have questions and Bill can help us navigate that. And while he's joining, I would say to anybody out there, if you're wondering how to get involved, I can say this, call Michelle. She got me passionate about this topic. She got me going, and I feel like that both I and my organization are the better off for it.
Well, thank you. Yes, please call me if you have ideas or you're willing to help in the way that Horacio has been helping. We would love and need more leaders to lift up their voices and take the assets of their company, the unique assets, I would say, of Booz Allen, for instance. I mean, think about, they have incredible economic analysts on their team. CARE didn't have the capacity to look at the estimation of what will be the costs, for instance, here. So really important to think about what are the assets that you might bring to what I think is really a generational challenge for all of us.
So it sounds like the whole conversation we've been having is all about mobilization. And you guys are Michelle, you seem to be the mobilizer in chief. Whether it's a government, whether it's a corporation, whether it's a small business or group. But, there are 3 or 4 arguments that you've baked in there in your conversation, as well as in the study. One is the economic imperative or the economic case for action. There's clearly a moral case for action. And then there's this pragmatic case for action that you could take any number of ways. In the organizations, let's just say the government you're talking about in terms of trying to move the ball forward. I know you've written legislative articles for magazines and whatnot. Where are you getting the most traction? The economic analysis, the moral imperative. Where does it really resonate?
I mean, I think there's some converging points, and I'll just jump in, and then I'd be interested in your perspective on this, Horacio. I think there is, it's a combination of, I do think people understand the humanitarian imperative, and people understand that we feel to stand in solidarity with people around the world. So we can save lives by getting ahead of this. I think the economic case does make a difference. I think people understand, especially those that understand how dependent our own national economy is on the global economy and getting back to some degree of normalcy. I hope also people do recognize, and Horacio mentioned this, the national security dimensions of this. When you think about fragile states, places that are already living within conflict, there is a great potential to have even more, I would say, levels of conflict and the kind of conflagration of conflict around the world as we go forward. And then I would finally say, from a congressional perspective, one thing that does seem to matter is I would say what we might call vaccine diplomacy and the role that America can play vis-a-vis China. I think there's a recognition that this is a moment in which we are going to be weighed around political leadership in the world, and the vaccine diplomacy that China is engaging in now. Again, Horacio, I think we once again see that the Chinese vaccine is not as effective, but we need to really think about what in 10 or 15 or 20 years do we think the role of the U.S. will have been at this moment, and how will that shape our long-term leadership globally?
Yeah, what's our legacy, in other words?
Right. Yeah, I think that's well said. The only thing I would add to that is, the good news here is there's so many good arguments. And so few arguments against doing this, that this is one of the cases where you can actually meet somebody where they are. If they're on the national security front, there is a national security argument to be made that is very compelling. If you're on the economic front, if you're on the humanitarian front, if you're in terms of equity and equality, there's so many good arguments. And so I think part of what Michelle and I have been trying to do is again, meet people where they are in Congress, depending on who your constituency is. How do you talk about this? There's a lot of goodness here, and much of it is about getting the word out and getting people to think about it. And once they click, the rest of it happens.
Right.
One last thing is, I do think we are all by human nature, and I think certainly within our American political system, perhaps better at confronting what's immediately before us than what's in front of us over the longer term. And so, for instance, there was a huge kind of outflow of resources and investment in India when people saw the images of what people were facing, dying in the streets, literally. And yet it is much more cost effective for us not to build hospitals, but for us to vaccinate the tens of millions of people in India and get ahead of this curve. So my hope is that we can apply all that logic with the sense of the urgency that's required for us to ensure that we don't get to the worst possible case scenarios here.
Well, and it not to oversimplify, but we drill down into the supply chain. And if there's anybody that knows supply chains, it's Booz Allen for sure. But the supply chain is, again, about mobilization. It's about the last mile. I was intrigued by what's included in the last mile. The 5-to-1 ratio is a classic economist trick to, here's what you're looking at, which is the vaccine costs. But now it takes 5 times that amount of money to get that into people's arms. But then if you get into that supply chain, you have the South Sudan issue versus Rwanda. Rwanda had not an easy job, but a thorough job of putting in place. Hell, we can't even get everybody in Georgia to get a vaccine. So talk a little bit about that last mile and the complexity associated with it. That you're really trying to mobilize people around, because don't you have to go in to get governments to change their points of view? And there's a different policy in every country you go into, not to mention a different strongman or intellectual issue.
I'll start real quick, but I think Michelle has much more to say about this. At the end of the day, you're absolutely right. There isn't a one-size-fits-all solution to this. You have some countries that are clearly eager to work this, that have some infrastructure that you can leverage, and it's a question of facilitating that process. You have other countries that they're starting from scratch, and you have other countries where, for whatever reason, their governments are actually actively not helpful. And you have to have a different approach and a different strategy for each one of those. My little plug is, I think these international NGOs can play a huge role across that entire spectrum. Country to country is important, and it'll work in lots of cases. But I think there's many instances, and this is something Michelle and I have talked about as the next step, where even when a country wants to do the right thing, even when the government is all in, right, they still don't know how. They still don't have the capacity to get there. And that's where CARE, with having done this around the world, having an established presence with local teams that actually know what's happening on the ground, can really be that bridge from wanting to do it to actually getting it done.
Yeah, I would just add that you have examples, as you say, that are hopeful. Rwanda was able to deliver all the vaccinations within 3 weeks, whereas the DRC, which is a neighboring country, as I already mentioned, had to turn back 1.3 million. So we know that we can do this. We need to be able to consult with governments to ensure that they have the right kinds of capacities and plans in place. We need to work with, I think, frontline health workers. This is one of the things that I think we've neglected. We have the dependence upon those frontline health workers. We have them here in our own country. Who've done heroic and Herculean work, and around the world, 70 to 80% of those, and 80% in most places, are women. Actually, about half of those frontline caregivers that we're going to be depending upon are not paid anything at all. So this is a part of the dimension of how do we build our health infrastructure to ensure that we have the capacity for delivery now, but also how are we making some investments that can help us to both guard against and be able to respond more quickly to future health pandemics, global health pandemics that we might raise. I know, Michelle Flournoy, who is one of the leaders in the national security establishment, is on both CARE's board and Booz Allen's board, speaks so eloquently about the fact that I think the national security leadership has begun to truly understand how interdependent our national security is on our global health infrastructure. And we do have to just start making some different kinds of investments. We also recognize vaccine hesitancy. This is going to have to be a part of the work that's customized to each country. CARE is doing this work. We know that basically people's sense of confidence in vaccines is largely dependent upon their trust in not frankly in government. It's based upon their trust in their frontline caregiver, their doctor, the person who's giving them that shot, somebody from their own community. So it's really important that we equip them with the right information and the right capacity to deliver those vaccines.
Right. Could you talk through a couple of examples you see that are success stories for CARE in terms of getting shots into arms, or is it premature?
Yeah, I mean, I think I would say a couple things. One is we just have to look to history, look to Rotary about what you've done with the polio vaccinations, and talk about last mile delivery. So again, we know that we can get to some of the most remote places. We know that we need to, in this instance, get closer to 80% to herd immunity. So we have to get, and at minimum, we have to get to the 20% of the most vulnerable populations from a humanitarian perspective in these low-income countries. We're not necessarily set to do that. I would say that there are success stories. Look at Rwanda. Look at places like Sri Lanka. So we know that we can do this. But we do need to ensure that we kind of have the right kinds of investments. We can also see this. I mean, again, you look at Ebola in West Africa. It wasn't a vaccine campaign, but it was through public health measures. Right. So in India, for instance, right now we're going to have to, and this is true everywhere. Not only are we going to have to care for those who are immediately sick, we're going to have to get the vaccines out, and we're also going to have to institute smart public health measures, because there are going to be another year or year and a half where many people are not vaccinated. So all of those are part of the dimension that we need to support organizations like CARE and governments around the world to institute in order to ensure that we tamp down and eventually defeat the virus.
So both of you, to question to both of you are now president of the United States, and you said, okay, this group has come to you and said you need to spend $5 to $7 billion a year over the next 3 years to try to make sure that we get safe, get help do our share to get the world safe. So where do you spend it?
I think Michelle said it really well. I mean, I think obviously it's across the entire supply chain, but this issue of frontline health workers and making sure that frontline health workers around the world have what they need to get this done, that there's enough of them, and so forth.
Is that helicopter money? Is that helicopter money, or are you giving it to the governments? Or are you giving it to the NGOs? Where do the dollars go? That's a lot of money.
I think it's you need a real strategies, continent by continent and country by country. Organizations like USAID should play a significant role. INGOs should play a significant role. In some cases, direct assistance to governments might play a significant role. I don't think there is a one size fits all. I'm not saying this is easy. I'm saying when there's a will, there's a way. And I think the good news, at least from my perspective, I believe the will is now there. So now we are here at the precipice of finding the way.
Yeah, I would absolutely agree. It's a multifaceted approach. It would go to COVAX, the UN network, USAID, some direct to governments through CDCs like the African CDC, the US CDC, and to coalitions of INGOs. CARE is working with 6 of the largest INGOs to work with in coalition around mobilization in multiple countries. So, and I would just sort of say, as president, I would be telling the American people, this is a tiny fraction of an investment in order to ensure the most enormous return that you can imagine, which is the capacity for saving lives, millions and perhaps tens of millions of lives, and also in order for us to return to any sort of normalcy, both economically and from a security perspective, this has to be done.
Huge issue to get your arms around. Well, since we're talking presidents, maybe we should ask President Catherine to come back on, and we'll see what she has to say. As I leave you, thank you for your time and effort. And President Catherine, the show's yours.
Thank you, Bill.
Thank you, Bill.
So the two of you and your firms are clearly formidable partners in crime. And we are so grateful that we have these two incredible global leaders, but that also you have this firm foothold in Atlanta. So thank you. I don't even know where to start in my appreciation for the work you're doing to save the world. So one question, I guess a final question. Clearly, you have a daunting challenge ahead of you both. What keeps you hopeful? How do you stay motivated? You get out of bed in the morning. What gets you fired up to go attack it one more day, one day at a time?
I'll jump in and then I'll let you have the final word, Horacio. There's Fred Rogers, Mr. Rogers had a quote that I love, which is something to the effect of when he was a little boy and he would ask his mom, he would read the newspapers and he would read about what's scary. And his mom would say, just look for the helpers. There's always people that are helping. And I think that's been so true over the last year and a half. And so I take heart in our frontline caregivers here in the United States who've been truly heroic. Of the 7,000 people that are on the front lines for care that are every single day standing up and taking risks on behalf of humanitarian relief. And the millions of frontline caregivers around the world, the women that are going to be delivering these vaccines. So I take heart there. And I would say I also take heart in the fact that Atlanta is at the center of this work. So if you think about CDC, if you think about CARE, if you think the Task Force for Global Health, Emory, this is a city that is very much at the heart of this, again, I think, generational effort to really rise to the moment.
I'll just add my 2 cents really quickly. I came to this country as a really late teenager. I was 19. I came here to go to school. And weeks after I came, President Reagan gave his last State of the Union address, and he talked about the shining city on the hill. And I had never heard it expressed that way. But for somebody who grew up outside the United States, this country has always been a beacon for hope. It's what attracted me and countless others to make a life here, to build a family here, to have a career, and to try to give back. I think this country just has inordinate capacity for good. And compared to the other challenges that the U.S. has led globally on, from World War II to putting people on the moon to reinventing this world so many times for the better, I'm not saying this is easy, but I think this is a small, manageable challenge for this nation and for its big heart to accomplish. And I'm both hopeful and optimistic.
That's wonderful. And when I think about Rotary too, we have such a similar history with our legacy of eradicating polio and our global footprint with all of our volunteers and member organizations. So I do hope sincerely that we can be aligned and allies collaborating in all of this with the two of you. So again, thank you so much for all that you're doing.
Thank you for having us.
Thank you, Catherine.
Terrific.